How is akathisia diagnosed in schizophrenia? Have you ever wondered how healthcare professionals identify akathisia in individuals with schizophrenia? It's a process that relies heavily on careful observation and patient feedback. Akathisia is a condition characterized by a feeling of inner restlessness and an uncontrollable urge to be in constant motion. Unlike many medical conditions, there are no specific laboratory tests or imaging studies to diagnose akathisia. Instead, the diagnosis is made through a thorough clinical evaluation. The first step in diagnosing akathisia involves clinical observation. Healthcare providers watch for specific behaviors and movements. Signs like pacing, rocking back and forth, or an inability to sit still are key indicators. These observable actions help clinicians identify the presence of akathisia. Next, healthcare providers will ask patients about their feelings. It is important to understand the subjective experience of inner restlessness or tension. Patients may describe a strong urge to move, which is a hallmark of akathisia. This inquiry helps differentiate akathisia from other conditions. To further assess the situation, healthcare providers often use the Barnes Akathisia Rating Scale. This tool evaluates both the visible movements and the patient's feelings. It provides a score that helps confirm whether akathisia is present and how severe it is. Differentiating akathisia from other conditions is also crucial. Symptoms can overlap with various psychiatric or neurological issues, especially in individuals with schizophrenia. Conditions like agitation from psychosis, anxiety, or restless legs syndrome may show similar signs. Therefore, healthcare providers carefully compare symptoms and medical history to rule out these other possibilities. Reviewing the patient's medical history and current medications is another important step. Akathisia is frequently caused by medications, particularly antipsychotic drugs used in treating schizophrenia. Understanding the patient's medication regimen can help link symptoms to potential drug effects. In summary, diagnosing akathisia in schizophrenia involves a combination of clinical observation, patient-reported experiences, and standardized rating scales. It is essential to distinguish akathisia from other overlapping symptoms. Early diagnosis is important because untreated akathisia can worsen quality of life and increase risks like anxiety. Adjusting or changing medications is often part of managing akathisia once it is diagnosed.